Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Pharmacy Medicine and today we will continue with mechanical asphyxia. In today's video, we will discuss about fractures associated with mechanical asphyxia. First of all, we will discuss about hyoid bone fractures. Hyoid bone is a U-shaped bone with a center horizontal body and which has greater horns attached to either side of the body. So it is like a U-shaped bone. There is a greater horns which are present at the end of the bone, attached to either side of the natural joint. Usually, the connection between the greater horn and the hyoid bone is usually cartilaginous in early life, and it becomes ossified about in middle ages. Fracture of the hyoid bone usually occurs in 50 to 70% of cases of mechanical asphyxia, and usually seen about above 40 years when there is cartilage between the greater cornea and the hyoid bone body becomes ossified. Hyoid bone fractures are classified into three types: inward fracture, anterior posterior fracture, and eversion fracture. In inward fracture, it is also known as sideways compression fracture. These are seen in case of throttling. So in throttling cases, a hand is used to compress the neck, and because since the fingers presses the neck, it causes compression of the hyoid bone. As fingers of the grasping hand squeezes the throat, this fracture occurs. The greater cornea of the hyoid are compressed inwards. So greater cornea, which is seen in the body here, it's compressed inwards, causing fracture of the bone with tear of its periosteum on the outer side. So periosteum, which is usually covers the bone in the thin layer, is usually torn in this cases of inward fracture. In the outer side, it will be torn and not on the inner side, displaying the posterior fragment inwards. So in the inner side, the periosteum will be intact and the fragment will be displayed on the inwards. This type of fracture can occur on both the sides. It may occur in one side if the pressure, based on the pressure application, it may occur on one side, or sometimes it may occur in both the sides. A similar fracture may be seen in the joint between the greater cornea and the body of the hyoid. So sometimes it may be also seen between the greater cornea and the body of the hyoid. This can be demonstrated, fracture can be demonstrated by holding the body of the hyoid in one hand and the distal fragment between the finger and the thumb. So if you hold the body of the hyoid in one hand and distal fingers, and finger and thumb on the other hand and press it, the distal fragments which is fractured can be easily bent inwards, but the outer movement will be limited and it will be just up to the normal point it will be present. Now coming to second type of fracture, it is anterior posterior compression fracture. This is seen usually in case of hanging cases. Also sometimes it may be also seen in ligature strangulation if ligature is used. This is caused by anterior posterior compression. So if neck is compressed anterior posteriorly, this type of fracture is seen. So hyoid bone is driven in directly backwards. So the hyoid bone is driven backwards, which causes the outer layer, greater cornea to break out, diverging. So it causes divergence of the greater cornea, causing the fracture with outer displacement of posterior small fragment. So anterior posteriorly, the hyoid bone is compressed, leading to distal fragment to fracture outwards. So as a result, the periosteum on the inner side of the fracture is torn. So if you see the periosteum, it will be torn from the outer inner side, but on the outer side, it will be intact. And it can be fragment can be easily moved outwards since it is fractured, but inner movement, if you try to move inside, it will be limited up to the normal position. This type of fracture can also occur in greater cornea at its junction with the body, and it may be bilateral also. They also seen in cases of ligature strangulation where ligature mark is used. Sometimes if the neck is run over by a motor vehicle, or if there is a blow from the neck from the any means, like if there is a rod is used, a foot or stick is used on the neck, this type of fracture can be. If any rods are used in the anterior posteriorly, this type of fracture can be seen. Next type of fracture is eversion or traction or tug fracture. This occurs because of hyperextension of the neck or muscle overactivity. Usually, the hyoid bone is attached with many muscles, and these muscles, whenever if the hyperactivity of these muscles can cause the part of that bone to get fractured or displaced. So it occurs because of overactivity as a result of traction on the thyroid ligament, either by downward or lateral compression, or when direct pressure is exerted between hyoid and the thyroid by pressing fingers. So thyroid is attached with the hyoid is attached with the thyroid with the ligaments, and if any because of hanging or because any way there may be hyperactivity of muscles or by pressing fingers. This may cause the traction of the body traction leading to fracture. Usually the hyoid bone is drawn upwards and held rigid in these conditions. It should be noted that the cartilages which separates the cartilages part which usually separates the greater cornea with the body or joints between lesser cornea and the body or presence of incomplete body union of the hyoid parts should not be mistaken for fractures. So these are usually seen in the lesser age groups like less than 40 years of age. The body parts are usually made up of cartilage. The joints are made up of cartilage, and this should not be mistaken for fracture lines. A hyoid fracture should not be diagnosed as antemortem if there is no blood or hemorrhage is not present. In any antemortem death, there should be recent hemorrhage should be present at the type of at the fracture site. Then only it should be considered as a antemortem fracture. Now coming to thyroid cartilage. Thyroid cartilage is made up of a shield-shaped body, and usually it is made up of like a uh, shield-shaped body with and in the shaped in the middle. At its backside, there are inferior horns attached to the body. So usually, it is a shield-shaped cartilage with inferior horns present. It is made up of entirely of hyaline cartilage and get ossified earlier in men than in women, usually about 25 years. The entire thyroid cartilage is made up of hyaline cartilage and it gets ossified about 30 to 25 years of age. Usually it occurs, it usually ossifies more in early in males to 25 years than females. In males, it is usually the angle is more prominent compared to females. The fracture of thyroid cartilage, the fracture usually occurs at the superior horns of the thyroid cartilage, and this is usually depends on the state of ossification of these structures. So usually hyaline cartilage is very flexible since because of that it may not be get fractured. Usually if it has already been ossified then only the fracture occurs, which is always commonly seen in case of hanging cases. Thyroid fracture can occur only in cases if it is already ossification is started or ossification has been completed, usually more than about 25 years of age cases. These are my references. Thank you.